welcome to another episode of Nurse Talk. I have Maisha and Jennifer here with me today, and we are discussing stroke. Also known as a brain attack, a stroke occurs when there is ischemia, which is an inadequate blood flow to part of the brain or hemorrhage into the brain that results in death of the brain cells. Now, this is an important issue to talk about today because about 795,000 people a year suffer from a stroke in the U.S. In Texas alone, there's a death rate of 50 per 100,000 from stroke. Many know that we have Memorial Hermann right here next to HBU's campus. They will see hundreds of stroke cases and provide treatment and rehabilitation. But what if stroke could be prevented in the first place? With the Bradshaw Fitness Center in reach, many changes can be implemented to reduce the risk of suffering a stroke. Also in this segment, we'll be discussing signs and symptoms of stroke, detection and prevention, and treatment and resources if you ever do suffer from a stroke. So Maisha, what factors can lead to someone suffering from a stroke?
Well, Claire, when it comes to risk factors, it is important to understand that there are two classes. Modifiable are things that we can change, and non-modifiable are things that we can't. By understanding these, the overall risk of suffering a stroke can be reduced. So first, let's understand some things we can't change. Gender. Men have a higher incidence of suffering a stroke. Ethnicity. African Americans suffer a higher incidence of stroke. Age. Being 65 years or older increases your risk of having a stroke. Important things to focus on include what can be changed. These include hypertension, heart disease, smoking, excessive alcohol consumption, obesity, sleep apnea, metabolic syndrome, lack of physical exercise, poor diet, drug abuse, use of some birth control pills.
So with modifiable risk factors, there's things we can change in our lifestyles to reduce the risk of suffering stroke. Share with us some of those preventable actions we can make.
Prevention includes health promotion for the healthy individual, which involves things like a healthy diet, weight control, regular exercise, no smoking, limiting alcohol consumption, routine health assessment. Education and management of modifiable risk factors to prevent stroke, such as controlling high blood pressure, controlling diabetes, lowering the amount of cholesterol and saturated fat in your diet, quitting tobacco use, eating a diet rich in fruits and vegetables, treat obstructive sleep apnea if present, avoiding illicit drugs, adhering to a medication regimen that may include drugs like antiplatelets, which include aspirin and Plavix.
Okay, those all sound like great ways to take charge of personal health. It's also important to know the signs and symptoms of stroke, so help can be immediately sought if you are experiencing a stroke. What are some of the signs and symptoms of a stroke, Maisha?
Signs and symptoms include trouble with walking, trouble with speaking and understanding, paralysis or numbness of the face, arm, or legs, trouble with seeing in both or one eye, headache. Remember, if you think you or someone near you is experiencing a stroke, think fast. That this acronym will help remind you of what to look for. It stands for facial drooping on one side, arms, inability to hold both arms up evenly, speech slurred, time, call 911 immediately.
Thanks for sharing that, Maisha. So let's say an individual has experienced the symptoms and has called 911 and is now receiving care at a hospital thanks to quick action. What can a patient expect when it comes to treatment and management, Jennifer?
A rehabilitation plan is set up by the healthcare team to address the most common initial needs of stroke survivors. Assistance will be made for the relearning skills of activities of daily living. There will be a range of motion program to treat stiffness and spasticity, as well as help from a speech therapist to work with abnormal speaking or swallowing issues and to provide strategies to prevent aspiration. Cognitive functioning will also be assessed in rehab to provide treatment and education regarding the patient's medication regimen. It's also important, Claire, for patients to understand how a stroke can affect their life after the event. Cognitive, physical, and emotional aspects may all require some readjustments. These effects include loss of awareness, a term called neglect, is used to where the patient will ignore items on one side of the body because of the rest of losing mobility or feeling in arm or leg or even loss of vision on one side. Perception. Survivors of stroke may not be able to recognize and understand familiar objects as they once did because stroke can affect an individual's ability to see, touch, move, and think. Hearing and speech. Difficulty in articulating their thoughts, aphasia. Speech can be slow, slurred, or distorted, making stroke survivors difficult to understand, which is also called dysarthria. Chewing and swallowing. Stroke can also affect the muscles of the mouth, tongue, and throat, causing problems with chewing and swallowing food, a condition called dysphagia. Inability to think clearly, clearing out simple tasks can also be a challenge. Depression, especially common in patients with left hemisphere strokes. Emotional abnormality, which is excessive mood swings due to the location of the stroke and its impact on the emotional center of the brain. These mood swings can range from inability to control laughing or crying spells. Sexuality after stroke can be a concern for patients to resume sexual activity after stroke due to a feeling of discomfort with body changes and or a fear of intimacy. Stroke survivors are also likely to develop a loss of interest in sex. Mobility or limb impairment. After a stroke, signals from the brain to the muscle can be damaged, leading to paralysis of the arm, leg, or both, which can cause spasticity, where the muscles are tight, stiff, and are resistant to stretching.
And I understand there's many avenues for survivors of stroke to receive support?
Yes, that's correct. Some of the spiritual and emotional support are not only for the survivor, but their family as well, like therapy where the patient and family will work for acknowledge feelings about the stroke, which may include denial, anger, depression, guilt, or responsibility for the caregiver. And these feelings are normal and expected because they must be addressed. Take moments of the day to focus on other things and take your mind away from the situation by doing activities of enjoyment. Rely on a support system that will consist of extended family and friends. For the family of the stroke patient, it is especially important to speak with the medical team, nursing staff, and therapists about the needs of the patient following a stroke. Take time to read articles related to stroke and attend support groups.
And Jennifer, what's the overall goal?
The overall goal is to help the patient recover as much function as possible. Stroke rehabilitation therapy often involves repositioning, range of motion activities, and muscle strengthening exercises to enhance movement. Therapy may also involve sitting up, moving from bed to chair, standing, walking, or other tasks such as dressing, bathing, and using the toilet. Encouraging physical movement is critical to recovery. In cases with speech and language challenges, alternative forms of communication such as pictures, verbal cues, writing, and computers may be used. Innovative techniques are also used in regaining control of swallowing muscles.
Very good. Well, I want to thank Maisha and Jennifer for joining me today, and thank you for joining us on our discussion of stroke here on Nurse Talk. Have a good day.